going to tell a little bit about what has been done in Brazil in regard to insecticide-resistant issues. So we've been using organophosphate since the first case of dengue in the last 30 years. And we used to use the larvicide Temefos and the adulticide phenyltotrione and the malathion until 2009, when you noticed that the organophosphate was no longer killing the larvae. Then a national monitoring network was created then for evaluating insecticide resistance in Aedes aegypti, and the first results of this network convinced the authorities to change the organophosphates, the adulticide organophosphates, to deltamethrin. That was the odd option. And the larvicides, we tried to change it to the BTI, but we had problems with the temperature and the luminosity that made the BTI not work efficiently. But also if IGRs complained the juvenile hormones and benzophenylureas. But soon after the substitution of deltamethrin, the organophosphates to deltamethrin, the pyrethroids, we saw that the pyrethroids were no longer working due to or cross resistance or the rapid selection of another mechanism. Currently, what the Brazilian National Program for Dengue Control recommends, in Brazil, the national government buys the insecticide and distributes to the whole country. So the whole country has to use the insecticide that is recommended by the national government. And nowadays you're using the larvicide pyriproxyfen, which is a juvenile hormone, and to adulticides we're using malathion again because we cannot use pyrethroids anymore due to the high levels of resistance, and also the carbamate benzocarb. Here is an example what's happened with the Temefos, right? There is a recent work showing that these dots are the municipalities that were monitored for resistance to Temefos. They are sentinels or strategic municipalities. This is the example of the Temefos resistance evolution in Brazil. And you see that in the beginning, there was, in green, we had the susceptible populations, and in red, the most resistant populations. And what you see is that the resistant populations start in the littoral, in the northeast, and get spread through the whole territory. See, the most recent figure is like most of the territory has resistant population, highly resistant populations to the Temefos. And the same is happening with the adulticide. Here is also an example showing that nowadays we have high levels of resistance to deltamethrin, but we do have susceptibility to IGRs so far, and also to the adulticide malathion. But I'm not very confident about it because we're using the diagnostic dose to the malathion. It's we're very suspicious about these diagnostic dose to malathion. One of the principal mechanisms for pyrethroid resistance, as people said here, is the KDR mutation. And here you can see the spread of the KDR mutation in Brazil. Here in blue is the susceptible allele, and in orange and red, the resistant allele. As David said, this red one represents the allele that has the 2 KDR mutations simultaneously, and where we have the highest levels of resistance. And we see the spread of this red one, the most resistant, is more concentrated in the southeast and central west of Brazil, and also in the extreme north. And what you see is that these mutations are also very well correlated with the genetic backgrounds of those populations. If you see, I didn't bring here the illustration, but we see that Brazil has 2 main genetic backgrounds of their populations, and it's very well correlated with the KDR mutation, the levels of resistance. Here is a correlation. We can find a correlation in between the resistance levels and the number of dengue cases, for instance. So here we see in population municipalities of São Paulo state, where we have the higher level of resistance of mortality. The mortality. We have the lowest number of dengue cases. On the opposite, if higher resistance rates also means a high number of dengue cases. Right? It means that they're using more insecticide, they are being not more effective, and it converts in an increased number of dengue cases. So, concluding, we have to pay attention and improving monitoring tools. So bioassays procedures have to be standardized, not only inside the networks, but among different countries, different networks, so we can compare the results. The diagnostic doses, as many said here, must be well confident for all insecticides used in vector control. Also, identification of new molecular markers, that was said, for resistance may, and also in combination with the knowledge of the genetic background of the populations, can significantly improve the monitoring. And also training and enforced surveillance, like vector control teams must be trained and equipped to perform monitoring. Evaluating efficacy of vector control in the field must be enforced, as we have many few people trained to do this kind of work. And also the importance of a network has been enforced in here. The importance of insecticide-resistant monitoring networks, well integrated, and this is important, able to talk to the decision makers in real time. Something that was happening in Brazil, we had a very well-structured network, but our results to the Minister of Health, to the decision makers, were very delayed. Our talk was not happening in real time, and it took a long to make the decisions based on our results. And when they made something, the results were already very different, because the dynamics of insecticide resistance is very fast. So we have also improved our experience in sharing the advice. And this kind of network that we are talking here is going to help a lot in this kind of procedures. And also the development of new tools, novel insecticides, novel methods for evaluating the bioassays, for instance. And something has to be done in regard to the impact of household insecticides. We're talking here that the Brazilian example, that we are no longer using pyrethroids by governmental campaigns due to the resistance, but in every house you go, you have a can of pyrethroids there. So we're still using pyrethroids, you know. And Isabel, maybe you want to talk about the last